Hi everyone, welcome. Thank you for joining. February is Heart Month, so today we'll be talking about heart disease and bariatric surgery with one of our bariatric surgeons, Dr. Charles Keith. If you have questions throughout the chat, feel free to comment them and we'll try to get those answered for you. So let's dive in. Our first question is, how does excess weight impact your heart?
Well, that's a great question, and thank you for being here with me today. It's a very important topic when we talk about bariatric surgeries. There's just so many health benefits, and definitely heart disease is one of those that really has benefits from a bariatric surgery standpoint. And it's really not surprising that heart disease is still the number one cause of death, and it continues to hold that ranking while the obesity rates really in the US and worldwide are increasing too. I mean, over a third of US adults suffer from obesity, and worldwide is catching up. And what's even scarier is our adolescents are catching up too at an alarming rate. But to answer your question, so why does obesity increase heart disease? It's really because obesity is for various reasons, but it really increases the risk factors for heart disease. There are several risks that are health risks that can contribute, and these are things such as type 2 diabetes, high cholesterol, high blood pressure, coronary disease. The list kind of goes on, and that's really the gist of how obesity contributes, because it contributes to those risk factors which then lead to heart disease. So it's not necessarily the weight per se, it's all the things that the obesity leads to.
Okay. So what kind of heart conditions can it lead to? Can be overweight lead to?
Yeah, so several. Very importantly, there's coronary artery disease, or that's heart disease, and that's what leads to heart attacks. That's when you develop plaques in the blood vessels that feed your heart the blood that it needs to help pump blood to the rest of your body. So it can lead to that. It leads to congestive heart failure. So that's when the heart just doesn't squeeze as well as it should. It doesn't pump blood like it should to the rest of your body, and that leads to symptoms like having fluid overload, when you have a lot of swelling in your feet and elsewhere, and also to symptoms of shortness of breath, because that same swelling that happens in your legs essentially can back up and happen in your lungs too. Other issues are arrhythmias. So that's when the heart doesn't beat in a normal rhythm like it should, and obesity contributes to that, and that increases your risk for even sudden cardiac death.
Oh wow. So what are some heart healthy habits that people can start doing now to lower the risk of heart disease?
Well, the good thing is you don't have to go do anything incredibly special. And there's a lot of great, everyday advice is good. Things like eat, healthier foods. That's a great starting point. Cut back on, the Coke sodas, those kind of things. Try to add 30 minutes of some sort of activity. It doesn't have to be anything crazy like joining a special gym and doing any kind of, extreme exercise program, but just doing 30 minutes of walking a day is excellent. Another thing is getting a good night's rest. Getting a good 8 hours of sleep at night works wonders for heart disease. And then, very importantly, if you struggle with smoking, and that's something that you do, if you can quit that, that'll work wonders for you from a heart standpoint and from numerous other standpoints as well.
Okay, so what about bariatric surgery? How can that help?
Yeah, so bariatric surgery really helps because it can reduce those risk factors that we were talking about, things that ultimately lead to heart disease. And so we have a lot of great studies that show this, and one of the earliest and most important looks at over several thousands of patients that suffered from obesity. And what they did is about half of those patients got bariatric surgery, and the other half did not get bariatric surgery. And we watched what happened at 2 years and then 10 years down the road to those patients. And what we saw was that the patients that got bariatric surgery had a decreased chance of developing many of those risk factors. Very importantly, one of those being type 2 diabetes. So the patients that had obesity but didn't have type 2 diabetes yet, they had a less chance of developing that down the road. Also, things like cholesterol levels and blood pressure all also were better for the patients that underwent bariatric surgery.
Okay. So would you say, is bariatric surgery helpful like just before the onset of symptoms, or are there benefits for someone who's already experiencing symptoms of heart disease?
That's a great question. It is, you are going to get the most bang for your buck if you come in earlier in the process and before you develop heart disease and those kind of risk factors. But that doesn't mean that you're not going to get a benefit from bariatric surgery if you already have those problems. That same study did look at patients that already had those kind of problems, and actually the patients that got bariatric surgery had a better chance of putting those problems, either curing them or putting them into remission.
Okay.
So bariatric surgery, getting rid of type 2 diabetes, making blood pressure normal for people, which decreases your heart risk overall.
Okay. If someone is overweight and thinks that they may be at risk for heart disease, what's the first step they should take?
So I think something that's very important is that they need to find a primary care physician or doctor or provider that can really be the captain of the ship as far as their overall health goes, and just screening for these risk factors and treating them and providing good everyday advice as far as how to minimize those risks. And if you do suffer from obesity, and especially if you have heart disease in your family, I would recommend going to our website, tylerbariatrics.com, or calling us and setting an appointment to come talk with us. And just because you're calling to set up an appointment with us doesn't mean you're signing up for surgery. You don't come in and we take you right to surgery. What we do is we like to talk and educate patients on the risk and what the potential opportunities and risk and benefits would be for them. And so I'd encourage you to schedule an appointment with us to see what options are there.
Okay, so once someone does decide to have bariatric surgery, what does that process look like for them?
Yeah, so once they make an appointment, and like I said, just because you come and make an appointment doesn't mean you have to have surgery or that you're signing up for surgery. It means you're signing up to learn more about it. You recognize that you have these risk factors. You need to come and talk to some experts about it. Mm-hmm. And so what we do is we start with what we call our seminar, and we meet as a group, and what we'll do is at that time you'll hear from bariatric nurses and hear about different dietary tips, exercise tips, those kind of things, just lifestyle changes that will need to be made around surgery. You'll also meet with bariatric surgeons, either myself or my partner Dr. Babineau, and we'll talk about the options that are available, the pros and cons of each one, who would be a good candidate for each one, who wouldn't be. And then after that, you even get to talk to some of our older patients who have had these surgeries before, and they can tell you their experience, because I can tell you what you can expect, but that's not the same as hearing it from somebody who's truly lived it. And then after that, you meet one-on-one with myself or Dr. Babineau, and we come up with an individualized plan for you based on your medical history and your goals, because everybody has a different, unique situation. So the same operation is not going to be, one operation is not good for everybody. There's nothing one size fits all about this process. And so that's when we formulate a plan, then you meet one-on-one with our office staff to come up with a roadmap to get there, which is some education courses and then some support groups, which are very beneficial, and then we move towards surgery. Okay.
So if someone with symptoms of heart disease has bariatric surgery, how long does it usually take to notice an improvement?
Yeah, that's an excellent question as well. Some of the risk factors for heart disease improve very quickly. So things like type 2 diabetes, which I'm very passionate about as far as bariatric surgery goes, that is something that get better within just days of surgery. So this isn't something where you have surgery and then you wait to lose a lot of weight and it gets better. What happens is you have surgery, and it is not uncommon for us to completely stop diabetes medicines for somebody before they even leave the hospital after surgery the next day. Blood pressure is pretty similar. Sometimes it can get down pretty quickly as well. So a lot of our patients leave the hospital on reduced doses or no doses of blood pressure medicines. And so it's pretty neat how that works. Some of the other risk factors like cholesterol and whatnot may take a little bit longer to come down to normal, but for the most part, it all happens fairly quickly. And some of my favorite stories, I even had a patient just last week who was 3 weeks after her surgery, and she had problems with kind of fluid overload, not being able to, just feeling short of breath all the time. 3 weeks after surgery, she came back and she had this new energy and was so thrilled that she was able to walk around Walmart and do her shopping without using a scooter that day. She also said she even felt good enough to go to Home Goods as well and made it around. So just incredible to hear how quickly people feel better, these symptoms can get better. That's one story you hear all the time, people that have surgery because they don't feel like they can keep up with their kids and grandkids like they used to. They want to be able to be there for them and play with them out in the yard, and then all of a sudden they come back and a couple months later they're chasing them in circles, and they say the kids or grandkids will even say they notice a difference. And so it's pretty neat for all the things that it can do for people.
That's awesome. Those are all the questions we have. Unless you have anything else you want to add on that.
Yeah, I just think it's very important to find a primary care physician. If you have, a lot of this is very genetic, so if it runs in your family, heart disease, diabetes, make sure that you have a primary care that can help you out, and then also come talk to us. Like I said, there's nothing about coming and meeting with us that says you have to have surgery. It's all about education. We'd rather you come and hear it from us, people who do this all day, every day.
Mm-hmm.
You know, the risks, the benefits, you know, what you can expect personally, rather than grabbing kind of pieces of information from Google and
Right.
wherever else. So I encourage you to go to our website. Again, that's tylerbariatrics.com, and take a look. And there's some education material there, and schedule an appointment to come talk with us.
Awesome. Well, like you said, if you'd like to learn more about bariatric surgery, their website is tylerbariatrics.com. They're also hosting a free information session in Nacogdoches on Thursday, February 27th, and you can find more information and register for that on their website as well. If you'd like to learn more about heart care, you can visit uthealthystexas.com/heartmonth. Well, Dr. Keith, thank you for your time today, and
Yeah,
thank
thank
you
you.
everyone for joining.